Lose a muscle, and you start losing your life. Injury, surgery, bed rest, even aging, can shrink muscle fast. Today we're looking at KLOW, a 4-peptide blend that may support recovery, repair, and rebuilding atrophied muscle. This is education only, not medical advice. First, what is muscle atrophy? It's the loss of muscle tissue, and it happens faster than most people think. After an injury, surgery, or even just 2 weeks of immobilization, you can lose 1 to 5% of muscle strength per week. Aging, illness, and chronic inflammation also drive atrophy. The longer it goes, the harder it is to come back. So what is KLOW? KLOW is a 4-peptide blend, sometimes called the GLOW stack, or the recovery blend. It combines 4 peptides that work together on healing, repair, and inflammation. The goal isn't building new muscle from scratch, like growth hormone peptides. The goal is restoring what you already had. First peptide, BPC-157. BPC stands for Body Protection Compound. It's known for strong tissue repair, especially muscle, tendons, ligaments, and gut lining. It also promotes new blood vessel growth at injury sites, which speeds healing. This is the workhorse of the stack. Next, TB500. This is a synthetic version of thymosin beta-4. It promotes cell migration, meaning your repair cells actually get to the injury site. It also drives angiogenesis, the formation of new blood vessels, and supports flexibility and faster healing of muscle and connective tissue. Third, GHK copper. This is a copper peptide, naturally found in human plasma, but levels drop sharply with age. It supports collagen production, tissue regeneration, reduces inflammation, and signals stem cells to repair damaged tissue. Bonus, it's also famous in skin and hair recovery research. Fourth, KPV. This is a small tripeptide derived from a larger hormone called alpha-MSH. KPV has strong anti-inflammatory and immune-modulating effects. Chronic inflammation is one of the biggest drivers of muscle wasting, and KPV helps shut that down. Now here's why all 4 together. BPC-157 rebuilds the structural tissue. TB500 recruits repair cells to where they're needed. GHK copper drives collagen and stem cell activity. KPV shuts down the inflammation that holds healing back. Vascular, cellular, structural, and inflammatory, all covered in one stack. Who actually uses this? Post-injury and post-surgery recovery, prolonged bed rest, aging adults losing muscle to sarcopenia, athletes wanting faster return to training, and anyone dealing with chronic tendon or joint issues. It's not a magic muscle builder, it's a repair environment. Standard dosing. Most protocols use 0.1 ml, which is 10 units on a U100 insulin syringe, once daily, subcutaneous. That delivers roughly 2 to 2.5 milligrams of GHK copper, and about half a milligram each of BPC-157, TB500, and KPV. Inject in the abdomen, thigh, or near the affected area for localized work. Cycle length. The most common protocol is 4 to 8 weeks on, followed by 2 to 4 weeks off. For chronic atrophy, some extend up to 8 to 12 weeks on, then take a longer break. Beginners can start lower, around 5 to 7 units, 0.05 to 0.075 milliliters, for the first 1 to 2 weeks, then move up to the full 10 to 15 units once tolerance is confirmed. Reconstitution. Add 2 to 3 milliliters of bacteriostatic water to the vial, with gentle mixing, never shake. Store in the refrigerator after mixing. With 2 milliliters of BAC water, your 80 mg vial delivers about 4 mg per 10 unit dose. Always verify your specific product label and concentration. The caveats. Most evidence is from animal studies, smaller clinical observations, and anecdotal reports. KLOW is not FDA approved for muscle atrophy. Side effects are generally mild, mostly injection site reactions, but long-term human data is limited. And here's the critical warning. If you have active cancer, tumors, or are at high risk, do not use peptides that stimulate tissue growth or angiogenesis without medical supervision. For best results, peptides work alongside physical therapy and progressive resistance training, not instead of them. Protein intake of 1.6 to 2.2 grams per kilogram of body weight matters more than any peptide, and address the root cause of the atrophy, whether that's nerve damage, hormones, nutrition, or just disuse. Peptides amplify, they don't replace. This video is for educational and research purposes only. It is not medical advice. Laboratory peptides are intended strictly for research, and not for human consumption. Always consult a licensed healthcare professional before making any health decision. Thanks for watching. If your body's been stuck in recovery mode, this stack is worth understanding. Drop a like, subscribe for more straightforward medical breakdowns, and comment what topic you want next.